This is Michael Smith of MedPage Today. I'm in Vienna at the International AIDS Conference, where scientists are discussing data reported in the July 21st issue of the Journal of the American Medical Association. The data concerns new methods of testing for HIV. As recommended in 2006 by the CDC, opt-in testing, where patients have to refuse an HIV test rather than accept it, should be the norm, according to the CDC. In Denver, researchers led by Dr. Jason Haukoos tested the notion in a large emergency department. The results, reported in the Journal of the American Medical Association and discussed here at a press conference, were both encouraging and disappointing.
Routine opt-out rapid HIV screening tested a large number of patients, in fact about 30 times the number of patients when compared to physician-directed diagnostic testing. It also increased the number of new diagnoses by about threefold. Offering routine opt-out rapid HIV screening in an emergency department setting does allow for us to test more patients. Unfortunately, it only allowed for a slightly increased number of diagnosed HIV-infected patients.
On the other hand, Haukoos said the uptake of the testing among patients left much to be desired.
This actually flies a little bit in the face of what the CDC recommendations call for, because they are calling for relatively widespread testing in this particular setting using this particular approach. And it turns out that it didn't work probably quite as well as everyone hoped.
In fact, more than 75% of the patients refused to be tested, suggesting that the testing model may not be optimal. I asked Haukoos about that in the press conference here.
This is a substantive, a big issue relative to this study, and I think a big issue relative to opt-out screening in general, in that we only had about, as you said, 20% of our patients who actually agreed to testing. Patients who didn't get tested during the opt-out phase, there were a number of reasons for that. They included, I think in part because of the clinical environment that we were in. Emergency departments obviously take care of critically ill patients and patients with all forms of potential disease, and they don't present to the emergency department thinking that they're going to be offered an HIV test in general. Some preliminary data, which we haven't published yet, suggests that a high proportion of them actually don't believe they're at risk. And so that's also a big issue relative to those who opt out. To finish your last point quickly, you asked what the optimal strategy is, and unfortunately I don't have a great answer for you. Maybe in a couple of years we will, because that's obviously the line of work we're working on. I suspect it falls somewhere between performing routine, non-targeted screening and diagnostic testing. I think diagnostic testing is the bare minimum approach in an emergency department, but it's, as you can see from our data, a bare minimum approach. And that there's some form of screening that's probably using a targeted approach that you could probably have layered on top of diagnostic testing that would serve as, I think, probably the most effective and efficient method in an emergency department.
In Vienna, I'm Michael Smith, MedPage Today.